Researchers say many Americans are having a tough time getting a handle on their blood pressure, and those high numbers could lead to a higher risk of a stroke. Dwayne Scott tells us what doctors found out.
A study led by University of Michigan Health finds that years of high systolic blood pressure, that's the top number on the blood pressure reading, significantly increases an adult's risk of having the two most common types of stroke. In fact, for every 10 points higher, the risk of ischemic stroke goes up 20% and the risk of brain hemorrhage increases by 30%. The physician who led the study says it's essential to get ahead of this condition.
Our findings suggest that early diagnosis and sustained treatment of high blood pressure over time are critical to prevent the two most common types of stroke, especially in Black and Hispanic adults who have higher rates of undiagnosed and uncontrolled high blood pressure than white adults in the United States.
Researchers found that Black and Hispanic patients have substantially higher risk of stroke. Levine says the United States has not seen significant improvements in blood pressure control in recent years, but notes that it starts with getting people more resources to manage it.
Some ways to improve blood pressure control on a large scale are to help patients measure their blood pressure at home by providing home blood pressure monitoring devices, increasing insurance access so that patients can access doctors and the medications they need for their blood pressure, reducing salt in foods, and increasing access to healthy foods.
Levine says to contact your health care provider if your blood pressure is 130/80 on 2 or more occasions. For your News Now, I'm Dwayne Scott.